you're debating between a home birth and a hospital birth and you feel like you just can't decide, look no further. I'm a midwife and I've attended births both at hospitals and in homes. When I had my first baby, I successfully gave birth at home, but then had to transfer to the hospital due to complications with my placenta. After a lot of ultrasounds and serious thought, I have finally figured out where I'm going to birth my second baby. Welcome back to Every Mom is Midwife. My name's Jess. I'm a certified nurse midwife and infertility mom, and I'm currently 29 weeks pregnant with an IVF pregnancy. When I had my 20-week ultrasound, I saw a perinatologist, also known as a maternal fetal medicine doctor, who specializes in high-risk pregnancies. The reason for this was because of my very stuck placenta after the birth of my first child. Despite a shot of Pitocin in my leg, aggressive nipple stimulation from my midwife, and breastfeeding my baby, that sucker would not come out. I transferred to not one, but 2 different hospitals in an attempt to get it out, and almost lost my uterus in the process due to a suspected accreta, which is where the placenta grows into the wall of the uterus, which is basically only treatable with a hysterectomy. Miraculously, despite this occurring during peak COVID, my midwife had been allowed to stay with me, and she advocated for me and encouraged me to get a second opinion. That second opinion saved my uterus, and though my placenta was really stuck, a wonderful OBGYN was able to literally wrestle it out in shreds. After she got it out, both she and one of the other OBGYNs that had tried to help me made the same joke, which was, well, no more home births for you. I was a little taken aback because honestly, after that experience, especially with the OBGYN who told me my only option was a hysterectomy, I had no interest in giving birth in a hospital the next time around. Initially, the maternal fetal medicine doctor that I saw this time around was also really not supportive of me having a home birth, but she told me to come back at 28 weeks to get a really good look at my placenta to help me make my decision. I want to present the risks and benefits of a home birth versus a hospital birth as unbiasedly as possible, but I think it's only fair that I preface with my personal preferences for a home birth. I don't ever want it to come across like I'm bashing hospital birth. Obviously, I work at a hospital. I think it's a fine place to have a baby. I just want my birth to be as demedicalized as possible. So let's start with all of the reasons why home birth is great. Pros. I do not want to have to try and get in the car when I'm in labor. I do not even want to step outside. I want to record my birth. The hospital I work at does not allow that. Some hospitals have a blanket policy of no recording, and some hospitals require that you get the consent of every person in the room to record, which brings me to my next point. I do not want a lot of people in the room. At my last birth, it was just myself, my husband, my 2 midwives, and a student midwife, and that was perfect. This time, I would also like the opportunity for my daughter to be there if she wants to be there, and that also becomes more complicated at the hospital versus at home. I want a student midwife at my birth, and you might be thinking, ew, a student, why? But trust me, no one will be more enthusiastic in their labor support for you than a student midwife. And I say that as a former student midwife. The student midwife at my last birth did a lot of counter pressure on my back for me during transition. And best of all, because she was helping catch the baby, she and the lead midwife did what's called a 4-handed catch, where both of them were putting counter pressure on my perineum and my vulva as my baby was born, and I did not tear at all. Most home birth midwives take on student midwives because then they have a free or low-cost birth assistant, and I see that as a major plus. Ultimately, the biggest benefit for me with a home birth is the overall vibe and low interventions. I don't want an IV, I don't want continuous fetal monitoring, and I don't even really want any cervical exams. I want a natural, uninterrupted physiologic birth, and most home birth midwives are pretty hands-off, and I appreciate that. Most midwives are going to head out about 3 to 4 hours after your baby is born, after making sure you're fed, starting laundry, and just making sure you and baby are well taken care of. Then they'll come check back in on you in about 1 to 2 days. All right, what are the disadvantages? The biggest and most obvious downside for me and for most women who are hesitant about home birth is the distance from medical intervention if you should need it. I currently live about 15 minutes from the hospital that I work at, but I know from experience, once you make the decision to go in, it usually takes a lot longer than that to actually get to the hospital. Last time, I only lived 5 minutes from the hospital, but from the time we made the decision to go in till the time we actually got there was closer to 60 minutes. And part of that is my own fault. We did not have a hospital bag packed. We did not have the car seat in the car. We were not prepared for a transfer at all. When you think about the fact that the uterus can lose half a liter of blood per minute after birth, you could bleed out over a 15-minute drive. Fortunately, there are medications that a home birth midwife can give you if you are having a lot of bleeding, but those medications are not always helpful if you have a stuck placenta. So that was my biggest concern with making the decision about where to birth this time. Now let's go over the hospital benefits. Quick and easy access to cesarean delivery, blood products, an operating room, and a surgeon if you need them. If you are inclined to use pain medication, most hospitals will have access to nitrous oxide, IV pain relief, and an epidural. And finally, you have around-the-clock support with breastfeeding or any newborn care if you need it. Hospital downsides, and I feel like this is going to sound like an inverse list of all of the pros of home birth. A big one for me is lack of sleep. You will usually be expected to stay about 24 hours after giving birth, and the nurses will have to check on you repeatedly to check your vital signs, have you fill out paperwork, and do various tests on your baby. You're also in a super uncomfortable hospital bed. There's random alarms that go off throughout the hospital throughout the night, plus chatting at the nurse's station. It's just not a peaceful or restful environment, and I'm already a super light sleeper. With my last birth, I did not manage to fall asleep once during our hospital stay, and I'd already been awake for 3 days at that point. As aforementioned, at our hospital, no recording of the birth. There's also just the sheer amount of information that the nurses are expected to go over with you. I've been on both sides of this. I was a labor and delivery nurse for 6 years before I was a midwife, and you have to check like a million boxes for each patient. Did I document vital signs? Did I ask my patient to rate her pain? Did I make sure she filled out the depression questionnaire? Did I have her watch the Period of Purple Crying DVD? My heart goes out to labor and delivery nurses and, quite frankly, nurses everywhere. The amount of charting that they're expected to do is completely unreasonable. And this means that during times when you would prefer to be resting or you just want to bask skin to skin in the glory of your newborn baby, you're going to be getting asked questions like, do you have electricity in your home? Do you wear a seatbelt when you're riding in the car? This might not seem like a big deal to a lot of people, but I know if I try to labor at home for as long as possible and then I give birth right after I get to the hospital, I'm going to be getting asked all of these questions while I'm just trying to enjoy those first few moments with my new baby. I do not have the patience for that, especially if my first golden hour with my baby is cut short because I have to go to the operating room to get my placenta out. The biggest downside for me is the standard of care of a lot of interventions. Having an IV placed, continuous fetal monitoring, and lots of healthcare providers in and out of your room. Even if everything is going smoothly with your birth, it might not be with the birth next door. So different nurses might have to pop in to consult with each other, or the house supervisor may have to come in and ask someone a question. You get the picture. Inevitably, those nurses chit-chat when they're in your room. And I don't want the ambiance of my birth ruined by someone complaining that they have to take their dog to the vet or that they're short-staffed for the night, let alone by the screams of another woman in labor. Baseline, I'm very easily irritated, and it gets so much worse when I'm in labor. For me, the decision about where to birth is answered by asking the question, where will I feel safe? It was a much harder question to answer this time around. I did seriously consider both options, and when I was looking into hospital birth, I was talking with the nurses that I work with about ways to mitigate my hospital complaints. For example, making a birth plan, outlining my desire for minimal interventions, or filling out a form with all of the admission questions ahead of time. It became clear from our discussions that I was going to be asked to sign a lot of different forms saying that I understood the risks of declining certain things, and the nurses were going to have to be continuously educating me about the things I was declining and documenting patient refused, and it just seemed like it was going to be a fight the whole time I was there. And maybe not necessarily a fight, but a disagreement about what was necessary. Again, no judgment if you do want this kind of care. I find a lot of first-time moms do want to be in a facility where they have the option for an epidural or a C-section if they need it, but personality-wise, it's just not for me. At our 28-week ultrasound, the maternal fetal medicine doctor said she could see a clear border around my placenta and that she didn't have any concerns about a necreta. So, after my visit with my OBGYN this week, I plan on transferring care to the home birth midwife who attended the birth of our daughter. I will have a backup plan with my OBGYN in case the placenta gets stuck again, but last time I didn't hemorrhage at all, so I suspect if we needed to transfer to the hospital, we would have time. I know some of you may be thinking, wow, that's a really big gamble. But I feel like we've done our due diligence with the extra ultrasounds and monitoring this pregnancy, and research has shown time and time again that home birth is a safe option. I also cannot put into words how completely traumatized I felt by my hospital experience last time. And just to clarify, the hospital that I worked at was absolutely wonderful when I transferred in, but when it looked like I might have an accreta, they transferred me to a high-risk facility where I absolutely was treated like a number. The first OBGYN I saw shoved his hand into my vagina multiple times with no warning. When they took me to the operating room, he tried to manually remove my placenta even though my spinal wasn't working, and when he shoved his hand in my vagina, again with no warning, I screamed and shot up the table, and he went, I can't work like this. I literally went to sleep under general anesthesia, not knowing if I would have a uterus when I woke up. It was completely awful, and I want to do anything I can to avoid the hospital this time. Sorry to end on a super intense note. Obviously, we did have a happy ending. Things worked out, and I got to keep my uterus. I hope you found this video helpful. If you did, please give it a thumbs up. If you're wondering how to decide between a midwife versus an OBGYN for prenatal care, I'll link that video next. I post new videos every week about infertility, pregnancy, and motherhood after 35, so make sure you subscribe and turn on the notification bell so you don't miss an upload. Thank you so much for watching.